Hi everyone, my name is Rosalinda Ochoa, and our topic was dehydration in adults above 65.
My name's Leslie.
I'm Joanne.
Hi, I'm Alejandra.
I'm Deep.
So, what is dehydration? Dehydration is when the body is lacking sufficient amounts of water or fluids. This causes the body to be unable to function properly. There are typically three main types of dehydration. We have mild, which can be controlled at home and requires slight interventions. Then we have moderate, which requires interventions and needs to be controlled before it becomes severe. Then for severe, this one needs hospitalization and immediate treatment. The common causes on the right, these are just the typical common causes of dehydration. The top three usually correlate with one another. We have vigorous exercise, fever, and extreme hot weather. These three common causes the body to sweat excessively, resulting in loss of fluids and electrolytes. Then there's intense diarrhea and vomiting, decreased intake of fluids. Younger children and older adults are usually more susceptible, and then certain chronic illnesses.
Here are some signs and symptoms of dehydration. The body's first warning signs are a dry mouth, dry skin, dark urine, and a decrease in how often you urinate. You may also feel unusually tired, dizzy, or develop a mild headache. These symptoms should prompt you to increase fluid intake immediately. As dehydration worsens, symptoms become more serious. You might notice a rapid heart rate or low blood pressure. You might see sunken eyes or confusion. Skin may lose its elasticity. These signs suggest that medical intervention may be needed. In severe cases, dehydration becomes a medical emergency. Symptoms like delirium, very little urine, and a weak but rapid pulse indicate the body is in serious distress, which can be life-threatening.
These are your typical diagnostics that they're going to be testing for. For the comprehensive metabolic panel, you're going to be seeing an increase in electrolytes, which is your sodium, chloride, calcium, and potassium. There's going to be an increase in the BUN and creatinine. This is going to be testing for your how well your kidneys are functioning. Then they're going to be testing your blood, which is going to be a complete blood count. There's going to be an increase in the hematocrit, hemoglobin, and glucose. And then they're going to be testing your urine. There's going to be a urinalysis, and this is going to be testing, it's going to show an increased specific gravity, which usually indicates that there's going to be an increase in the concentration of the solutes, which just means that there's going to be a lot of waste products in the urine, which is like your proteins, salts, and glucose. This chart right here on the right is going to show the different colors of the urine. The darker that the urine is, the more concentrated it's going to be, meaning there's going to be like less fluids and water in the body. So you typically want it to be on the light yellowish side.
So these are some of the treatments that you can do for dehydration. So for mild dehydration, you can take care of this at home. You don't have to go to the hospital. You can drink fluids like water, but more importantly, electrolytes. So you're gonna want to drink stuff like Pedialyte or Gatorade, as well as eat foods that are high in water, like watermelon, oranges, or cucumbers. And then moderate dehydration, you may or may not need to be hospitalized, but if you are, you'll get IV fluids that contain electrolytes, as well as you'll be monitored closely by the nurses. They'll be checking your blood pressure and things like that. You're going to want to avoid alcohol, caffeine, salty foods, and sugary drinks as well. And then for severe dehydration, this is a medical emergency, so you'll be hospitalized and you'll receive IV fluids, and they'll address the underlying cause. And then these are some complications for dehydration. There's mild to moderate, which you'll get electrolyte imbalances because you're going to be losing fluids and electrolytes. You'll get dark concentrated urine because your body's going to conserve any water that it does have. So your urine will be mostly waste and solutes. Then you'll get cramps because of the electrolyte imbalances. So your muscles need electrolytes to function, and you'll feel fatigue and constipation. So your colon's going to conserve any water that it has, it's going to retain it from the stool. So your stool will be hard and difficult to pass. And then there's severe dehydration, which you can feel complications like hypovolemic shock, coma, kidney failure, seizures, no urine output, again, because you're retaining all that water. And you're going to see low or no urine output, low blood pressure, confusion, and if you don't treat it, it may lead to death.
Okay, so I'm going to be talking about some key interventions that are important when we are taking care of patients with dehydration. So, monitoring intake and output is a way of tracking how much fluid the patient is drinking and how much they are losing through urine, vomiting, or diarrhea. And this will allow us to catch early changes and intervene before it progresses. So safety precautions we should be taking is we should keep in mind that dehydrated patients are at risk for falls. They may feel dizzy, weak, and they will also have dry, fragile skin that is prone to breakdowns. And someone with low volume, their blood pressure suddenly drops. So we need to keep in consideration the orthostatic blood pressure. And this can be a reason as to why patients may feel lightheaded or wait when they faint because they are changing positions. So fluid replacement is replacing the fluid that has been lost, and this can be done through oral rehydration or IV fluids. And then daily weights is also really important because one small change, such as 1 kilogram, can equal about a liter of fluid that is gained or lost. And then as for neurological changes, dehydration means less flow of blood to the brain. And this is one of the earliest signs, especially in older adults, which is delirium or confusion.
All right, here are some tips to manage dehydration. You can drink a full glass of water before exercising or going for a walk. Have a full glass of water when taking medication. Carry a water bottle and refill it throughout the day. Limit caffeine, soda, and alcohol. Wear lightweight, light-colored, and loose-fitting clothing in hot environments. And pace yourself during activities.
Here are a list of follow-up cares for the patient to do. First, we recommend the patient to follow up with their medical provider to reassess their blood pressure and urine color, as well as repeat labs such as sodium, potassium, B1, creatinine, CBC, and magnesium. We would also encourage them to test for urinalysis, such as urine-specific gravity. And then secondly, educate patient on the importance of drinking fluids regularly, such as water and electrolyte solutions, such as Pedialyte and Gatorade. Um, you also want to guide patient on daily fluid intakes regarding their age, weight, activity, and climate. Also encourage patient to recognize early warning signs such as dry mouth, dark urine, headache, as well as muscle cramps, and encourage patient to avoid any risks such as drinking too much alcohol, caffeine, or being exposed to heat. Some prevention strategies may include drinking about 8 ounces of water 1 to 2 hours when they're active. Also adjusting fluid during their illnesses when they're sick or vomiting, having diarrhea or fever. You want to encourage them to increase their intake of fluids. Also encourage patient to carry water, electrolyte drinks during the heat exposure or exercise. And then encourage patient to review medications with their medical provider when they are taking diuretics and laxatives. Here are some community resources we have included, such as the CDC. We have listed a link here, as well as the WHO Oral Rehydration Solutions, St. Mary's Urgent Care, San Joaquin Mental Health Mobile Clinic, San Joaquin County Human Services Agency, as well as San Joaquin County Public Health Services.
So we added a few questions, and the first one is going to be which of the following is not a typical symptom of dehydration? And the answer is going to be frequent urination. So you're actually not going to be urinating as much or at all.
Okay, and then here's question number 2. A dark amber urine color typically means, and the answer is B, that a patient is dehydrated. And here to the right, we can see what that looks like, a dark amber urine color.
And that's going to conclude our presentation. Thank you everyone for listening.
Yeah, thank you guys.
You.